Right, so hi everybody. Welcome to today's webinar, VA Psychology Training, a webinar for graduate school DCTs to learn more about VA training. This webinar is co-sponsored by APA Division 18's Veterans Affairs section and the VA Psychology Training Council. I'm Tiffany Fennell, Chair of the VA section of Division 18 and a psychologist at the VA Puget Sound Healthcare System, and I'll be co-hosting this webinar. And before we get started, I'd like to take a brief moment to mention that Division 18 Psychologists in Public Service has been the home for VA psychologists and other public service psychologists in APA since 1946. If you or your trainees are interested in learning more about Division 18 and the VA section, please check out our webpage. You can find it in the web links pod. And it's a real pleasure to partner again with the VA Psychology Training Council on this webinar. Over the past couple of years, we've co-sponsored webinars on how to get a VA psychology internship and how to get a VA psychology postdoc fellowship. We recorded the webinars from last fall's presentations and posted them online. You can check them out in the web links pod and share those with your trainees. And one last note before I introduce our presenters, a copy of today's slides can be downloaded from the files pod, and all questions can be entered into the chat box. And we'll leave time towards the end of the presentation today for questions. And if you experience any technical difficulties, please alert me in the chat box and I'll attend to you as quickly as possible. So now for introductions. We have 5 presenters from the VA Psychology Training Council today. First is Dr. Jeffrey Bates. He is the past chair of the VA Psychology Training Council and currently serves as the Acting Associate Director of Associated Health Education in the Office of Academic Affiliations. Dr. Amy Silberbogen is the Chair-elect of the VA Psychology Training Council and serves as the Training Director of the VA Boston Psychology Postdoctoral Fellowship Program. Our third speaker is Dr. Kristin Rodzinka, and she's the Chair of VA Psychology Training Council's Clinical Advisory Committee and serves as Director of Training at the Dayton VA Medical Center. Dr. Jamylah Jackson is the co-chair of the VA Psychology Training Council's Multicultural and Diversity Committee and serves as the Director of Training at the Dallas VA Medical Center. And finally, Dr. Dana Holohan is the chair of the VA Psychology Training Council and serves as the Director of Training at the Salem VA Medical Center. And so I'm pleased now to turn it over to Dr. Holohan.
Thank you, Tiffany. I'm excited to be here with everyone. I hope folks can hear me and see me, perhaps. Oh, good. I'm going to spend a little bit of time talking about VA culture. I was someone that was unfamiliar with VAs when I was going through graduate school and came upon the VA for my postdoc and have been in the VA ever since. And I think that's a common experience for folks that may not have had experience with VAs on practicum. They may go for internship or postdoc and never want to leave. Learning about the VA culture, I think, is important for graduate school directors to have a sense of fit for your trainees. And one thing about the VA is that although we're a large bureaucratic agency, when you've seen one VA, you've seen one VA. And so many of the things that are specific to one VA may not be applied to another. However, the culture of the VA is often something we can gather from the veterans that we serve. There's some things that are unique to serving in the VA. So one is that our patients are generally quite patriotic, which makes a whole lot of sense. And oftentimes those of us that work in the VA see our work as a way of serving. So for those that are non-veterans or veterans that are psychologists, I think being able to work with this group of patients is very honorable, and see that as a sense of purpose for all of us. We have a sense of gratitude for our work. I think that's very unique for some environments to have that sense of purpose or patriotism in the way that we're providing care. It's also a recovery-oriented healthcare institution. It's also very veteran-centric. Part of working for the VA, though, means that we're accountable to Congress, and other lots of institutions have a lot of say in what goes on at the VA. And there's many things about that that are fantastic. So, for example, I work in the PTSD world, and the VA was really out in front in offering trainings to all VA clinics to offer evidence-based care for PTSD, and was really in front of community providers in doing so. So part of being in a large government agency and that culture can have some benefits with resources and investments in training, investments in training programs and positions. A lot of the policies and procedures can be at an individual VA, but they also are things that are universal to VAs. For example, all VAs having a suicide prevention coordinator and programming. Part of fitting into the VA culture, I think folks have to have a sense of flexibility, in that there's some things that are maybe sort of rigid about being in a bureaucracy. So things like timekeeping, having tours of duty, earning your leave, all of those things are often adjustments from graduate school. And for some, they may not make that much sense. And to be able to radically accept that these are part of being in a government agency that come with that culture. At the same time, having all the benefits that come with a VA agency. So folks that are very diligent and flexible, or understand the veterans and have an interest in learning more about them, and we'll talk some more about that. Also, trainees that have a willingness to learn about the culture. We do military training for most of the trainees coming in that don't have that experience before. Also, finally, it's generally a professional environment, so that may be an adjustment from graduate school if we're working 7:45 to 4:30 and you have a 45-minute lunch exactly. Some of that may be unique and part of that culture that may be an adjustment. But overall, to me, it's one of the most fantastic jobs that one can have. I would not have done well on the battlefield, but feel very honored to be able to serve veterans and the VA. We're going to answer questions about culture later, but we're going to move over to Amy Silberbogen, who'll be talking about why considering VA training.
Hi, everybody. I just want to make sure everybody can hear me and see me. Someone could just let me know. That would be great. Great, wonderful. Well, why don't we zip forward to the next slide? I think, Kristin, you're... Oh, looks like some people are saying they can't see me. But can you hear me, people who are in the... Okay, well, let me see. Start sharing. So I am sharing. Oh, wait. Can you see me now? Okay, great. Sorry about that. I have a brand new webcam, so this is all new to me. Well, I'm glad that you guys can all see and hear me this morning. Thanks for your help. There's a good team of people working to make sure this goes smoothly. So I'm going to speak a little bit just about why we think that grad students should really consider training at VA, whether for practicum, internship, or postdoc. VA has a long history of providing education and training. In fact, trains the most psychologists in the country. Medical education is one of the 3 core pillars of the VA, combined with research and clinical care. Within VA, and because of our unique funding, there really can be a focus on education and training rather than on billable hours. Being a supervisor is often seen as a benefit and a privilege of employment rather than a collateral duty or something that people need to do on top of their other responsibilities. And the result is that supervision and training and education is just really stellar across the board within VA. As Dana talked about earlier, science drives care and decision-making within the VA. There are just a number of evidence-based psychotherapies within a diverse range of clinical presentations. And so we think one of the benefits of training within the VA is that there are just tremendous resources devoted towards training and certifying providers in these EBPs, just to make them widely available to veterans. Each facility has a local EBP coordinator, and trainees benefit this. The trickle-down effect is that trainees benefit because they get supervision by certified providers, and based on some local availability, may even have some opportunities to train with staff in some of these trainings. This really leaves them well prepared to treat a diverse range of presentations, relying on science after they leave the VA, or if they choose to stay within the VA. I just want to speak briefly about kind of the diverse clinical training experiences, including interprofessional training that VA offers. Within each VA is just a wide range of available clinical experiences, including inpatient, outpatient, patient, really touching every diagnostic category. Trainees will find themselves co-located or embedded in primary care or specialty medical clinics, in addition to, in and outpatient mental health clinics. And all this comes excellent opportunities for interprofessional training with providers across a broad range of disciplines. So again, a real strength, as so much of our care moving forward, nationally speaking, is really going to be team-based care to get that training from the get-go. Dana also spoke a little bit about social justice and public service work. Training at the VA really provides students with the opportunity to work with an underserved population. Veterans typically don't have the economic, or many veterans don't have the economic resources to seek health care elsewhere, or some choose to seek health care at the VA because it's so outstanding. So we really have the opportunity to provide care to individuals who risk their lives for our country, and this is an opportunity for us to give back and engage in some of this social justice or public service work. I think one of the really great things about being a psychologist within the VA, and that our trainees get to witness and observe, is that psychologists within the VA are often engaged in multiple professional capacities. So they're doing clinical work and administrative work and research. They have leadership roles. They're engaged in consultation and supervision and direct teaching. So it's really an opportunity for trainees to see psychologists work in a broad range of roles, be exposed to those roles, and kind of have their, their vision of what a psychologist looks like cracked open by observing their supervisors in these broad range of responsibilities. Well, it certainly is not a requirement to have prior training within the VA, and I think we often will be very excited to have a new intern who's never done VA training, or a new postdoc. So it's definitely not a requirement. It is beneficial to understand and be trained within VA when seeking future employment opportunities. We are dedicated to really trying to hire back people who have trained in the VA at some point. That said, we are also very open to people who have not had VA training previously, so that they can have that experience as well. One last reason why graduate schools, I think, should absolutely consider really encouraging students to train at the VA is that our funding is quite stable. It's written into the overall budget, assigned by location, so therefore funding is stable year to year with few exceptions. This allows for consistency in training, a commitment to training, because we're not worried so much about our funding sources. So those are the points that I wanted to discuss about training at the VA. And I believe I'm turning this over to Kristin. So I'm going to mute myself and certainly can take questions later today.
All right. And if I've got things on track, I think I'm ready to move us forward. So I'd like to share a little bit about how you can successfully prepare your students for VA training opportunities, and that would be at really any level of training, so psychology practicum experiences. Some of you may have affiliations with VAs in your area. Additionally, the internships and the postdoctoral fellowships, of course. And I will say that a lot of my ideas come from discussions that I've had with training directors in my community. We have a fortunate linkings and collaborations between the grad schools in our area. One of the most important things I think we can do is prepare students to be involved in a culture of training that is very invested and engaged in their future growth and development. So part of what we want in a trainee is someone who is ready and interested and prepared to seek and be open to feedback. Sometimes we have students who have had practicum experiences without quite the intensity and level of supervision and monitoring, and so trainees aren't always accustomed to getting direct and candid feedback, both about areas that they're doing well, but also areas we would like to see them to develop. So trainees who are ready and prepared to ask for that feedback and receive that tend to do extremely well in our environment. The next thing I'd like to speak to is just expecting to be both encouraged and challenged at the same time. I think embracing that dialectic, that if what we want is to train our future colleagues and future psychologists, what we want is to maximize every trainee's opportunity to develop all of the skills and competencies that we need as a profession, but also they individually want based on their training plan. Another area that can be a struggle, depending on what previous clinical experiences trainees have had, is it can be an adjustment to come into a professional, more hierarchical medical model. So our VA medical centers do tend to provide comprehensive care. We are providing interprofessional care, so working with physicians, administrators, a lot of other professionals. And so wanting to make sure that good comprehensive understanding of what professional deportment looks like can be very helpful. So that can be manner of dress, also just how you present yourself, what kinds of boundaries are appropriate. I think having some opportunities to practice those skills and understand a range of normal within different clinical environments can be quite helpful. And you'll notice some themes throughout these different topic areas, but I certainly think exposure to evidence-based psychotherapies, as well as structured diagnostic interviewing, and a range of different kinds of assessment can be very, very useful. We work with an extremely complex patient population, not only mental health issues, but medical issues, chronic pain, substance dependence, and so forth. And so having a really good holistic approach to assessment and some good foundational skills and case conceptualization so that EBPs can build upon them can be extremely useful. The next thing I'm going to speak to really is focused on assessment skills. I know we anecdotally have noted that there are some apparent differences in the amount of assessment experience that our trainee applicants have. Some have a fair amount of coursework as well as clinical experience, while others seem to be getting primarily coursework and less direct clinical experience. So one of the things that will prepare your students for a strong training opportunity in VA is to have a good foundation in assessment skills. So often VA training directors are looking for both academic and clinical experiences in assessment to include understanding how to appropriately select a test. So less being directed to provide a specific battery, but thinking about the referral question, determining what appropriate tools might be, what kinds of questions we might answer with different assessment measures, and what are the limits of certain tests, so with different patient populations, different areas of concern. So we want our trainees to have a good foundational understanding of reliability, validity, and practical application for assessment tools. It goes hopefully without saying that we definitely want our trainees to have some basic test interpretation skills, but also then an ability to do some integrated report writing, where rather than just identifying specific factors that come off of clinical scales, for instance, but really looking at the patient holistically, other data that we have, and how that all comes together so that one can write a good integrated report. So I think that if you are providing some direction to your trainees to think about what kinds of practicum experiences might be helpful in supporting their competitiveness for VA careers or VA training, definitely being aware that many VAs have expectations for both administration and scoring for cognitive measures as well as objective personality assessments can be helpful in giving those trainees the best chance they have of being competitive and then also having the skills they need to be successful with us. And I will, at that, pass this on to Dr. Bates.
Good afternoon, everybody. Let me just do a quick sound check. Can you hear me? Excellent. I just first want to say thank you all for joining us this afternoon. It will come to no surprise to my fellow presenters that I'm going to go off topic for just a second, and I will stay to my allotted time. I just want to highlight a couple of things about working for the VA before I start on the TQCVL. You know, we've talked before about the nobility and honor of this work. And I know this phrase is a gender-specific phrase because of when it was said by Abraham Lincoln, but you know, our mission to care for him who shall have borne the battle. I think about the nobility of that work of us providing to those who have stood in the gap for our freedoms and our liberties. I really, the nobility of that cause means a lot to me. And the notion of public service more broadly. I also just want to say, you know, I don't want to get into a history and systems lecture, but the history of our military and psychology development in our country. We can think about the Army Alpha and Beta testing, but really as it relates to this call, the history of accreditation in the APA was directly requested by the VA following World War II, when the VA asked to APA, how do we know that providers that are seeing our veterans are qualified to see our veterans? And I think that's important. I think that it's also important to look at some of the recent studies that compare our mental health care and our health care to community standards and compare us very favorably, either at or above community measures. And so one of the things that I want to say broadly to give you confidence in sending your trainees to the VA is this is a quality healthcare organization and a healthcare organization that is dedicated to quality cutting edge care for our veterans, both healthcare broadly and mental health care specifically. So I will now go back on topic and talk about the Trainee Qualifications and Credentials Verification Letter. This was a topic that we had a lot of questions about from DCTs last year, and we thought we'd take just a couple of minutes to talk through this letter, and if there's questions at the end of the presentation, I'm certainly happy to answer those. Last year, the VA had over 120,000 health profession trainees, so that's trainees across multiple professions. Certainly, the VA is the largest trainer of psychologists in this country, but the mission of the VA broadly includes, one of our statutory missions includes health profession training. And every health profession trainee who is brought on to the VA must have a TQCVL on file. And in looking at this, even if you might refer, some might refer, have heard the term WOC, that's a without compensation worker. That's what we would call a practicum student. Even practicum students must have a TQCVL on file that's been approved by the director or the director's designee. One of the important things to remember about stipend paid trainees, such as our interns or our postdoctoral residents, they must be U.S. citizens. There are some potential, there's the potential ability with the director of the medical center's approval, and as long as that individual is not taking away a position from a U.S. citizen, that a non-U.S. citizen could be appointed as a practicum student or as a WOP. But to be an intern or a postdoctoral resident, they must be a U.S. citizen. Further, to be a postdoctoral resident, you must also be from a APA or PCSAS accredited program. One of the benefits of the TQCVL is it provides protection for our trainees in terms of personal liability. We get asked the question often about maintaining liability insurance outside of the VA. If your trainee's been onboarded correctly by the facility, they have what's called tort claim protection, and part of that is started through the TQCVL at the very beginning of this process. Broadly, the TQCVL serves as the documentation that the trainee that's being onboarded by HR meets the requirements for appointment, and that's why that's such a critical step. There are some selective service requirements that if you are required to register with selective service, you have to have done that. If you didn't register, from time to time we run across that. It really is a tough road, and I'm not sure that it's a possible road if you were required to have registered, to have some type of documentation from the selective service that would say, hey, here's the reason why that didn't happen. In reality, that you have to have done that during a timely fashion. I believe that's prior to the age of 26, if I remember that correctly. Two other things that we get asked questions about from time to time are on the TQCVL, and one of those is the National Practitioner Data Bank, and the other is the list of excluded individuals and entities. And basically, these are two websites where you can search individuals by name. The National Practitioner Data Bank looks at medical malpractice payments and adverse actions against licensed providers. Even though your trainees are not licensed in the field of psychology, it's possible that they held a license in some other health profession. They may have been a nurse or a pharmacist in the past. And so I would recommend that you go ahead and check your trainee against that list. Every trainee, licensed or not, must be checked against the list of excluded individuals and entities. This looks at things such as certain types of criminal offenses like Medicaid fraud. Both websites provide very simple searches by name. If you get a negative result, meaning that your student's name is not on that list, then you can feel comfortable in answering that as not being applicable. The TQCVL also allows us to ensure that they are enrolled or they've been accepted in an accredited or VA-sponsored program. And for you all, it's going to be important about the enrolled in an accredited program. For our internships, the DCTs from the doctoral programs are the ones that complete the TQCVL because they still are a student in your doctoral programs. For a postdoctoral residency, since they've graduated, it is the training directors for the VA accredited postdoctoral residencies that would complete the TQCVL. The primary source verification or qualifications, that really is likely going to be letters of recommendation that were used or anything that was used to verify undergraduate degrees, the identity of the student, those types of things. Whether they're qualified and have the required credentials to participate in the training program. Much of that's also done through the API, but this is one form that allows us to go through and make sure as a double check that those things are recorded as well. That they're broadly eligible for an appointment to a federal government position, again, looking at selective service, citizenships, and those types of things. That they're physically and mentally fit to perform the essential functions of the training program. If you have questions about the specific guidelines, if you have an intern that's going to the VA next year, I would encourage you to reach out to your training director of that program if you have specific questions about this fitness for duty. Broadly, these are captured in 3 different levels. And from my perspective, the level for a psychology intern would go under what we would call level 8.1, which is the work is sedentary with no physical demands. But certainly if you have questions about answering that, reaching out to the director of training from your specific site would be helpful. And finally, that the student has been immunized following the CDC guidelines and VHA policies for healthcare workers. And basically, this is looking at tuberculosis screens, hepatitis vaccinations, and those types of things. On the next slide, let me go forward. There is a really helpful document, this TQCVL guide we've worked very hard on since the questions from last year. This guide goes through a lot of the questions that you may have about specific items. And at the end of this guide, you'll see the link for the current versions of the TQCVL, and then there's a spreadsheet where you'll actually list the students. So there's two separate pieces to this, and I would refer you to that guide. The Am I Eligible link takes you through a lot of the forms and information that can be used to screen for whether the student will be eligible or not. And then finally, we just included the selective service link here in case you have any questions about that process. And with that, I'm going to mute myself, and I think I'm turning it over.
Hi, everyone. Can everyone see and hear me? I'll wait for some responses. Okay, great. So I'm going to be talking about debunking some myths about VA training. Also, a reminder that you can ask questions. Just type them into the chat box, and we'll address them at the end of this section and go from there. So many of these myths about VA training have come from our work with local practicum students or local DCTs for the programs in our area. And so these are different questions that have come up and things that people brought up that we wanted to address more broadly. So the first myth is that VA practicum training is a must. Actually, that is not true. Applicants can be competitive without having had previous VA training. Obviously, if you've had a practicum or an internship within the VA, then that means you'll be familiar with the electronic medical record system and things like that. Know some of the vernacular. The VA is full of acronyms and things like that that someone would be familiar with. But it's certainly not a rule-out criteria. What's much more relevant to most programs is that students have experience with the clinical populations that we serve, diagnostically more so than specific experience within VA. So you don't have to have had a VA practicum or a VA internship if you're considering a postdoc. We love to, as was mentioned earlier, to keep our trainees on to the extent that we can, but we are always open to bringing in new folks as well. So the next myth is that the VA is where old men go to seek care. So with that one, I'm going to say that it's not false. We do have a large older male population within VA, but the VA population is actually very diverse. There are a number of younger veterans that we see within our clinics, in particular from the Iraq and Afghanistan conflicts. Those veterans tend to range between 20 and 40-something, depending on when they enlisted and those kinds of things, as well as folks from other eras like in the Gulf War or non-combat tours as well. So we actually do have a very broad range of veterans that we see. The VA also has really great specialized programming for different populations. So there are women's health programs, there are women's mental health programs, military sexual trauma programs that are for both men and women, LGBTQ specific programming. So there are many, many different types of opportunities and clinical experiences that trainees can have working within VA. Sometimes people will have the sense that I only need to work in a VA if I want to get experience with PTSD. And the VA certainly has many, many patients that experience PTSD symptoms or PTSD diagnosis, so you can certainly get a lot of experience with that within VA. But the VA serves a very wide diagnostic range of folks. Some folks have been involved in combat services and may experience PTSD or other conditions as a result of that. Some folks have never been involved in combat, and they might have civilian-related trauma or just civilian-related issues that they're seeking mental health care within VA for. So I think it's important for students that are considering training in VA to know that it doesn't mean that they're going to be seeing all PTSD all the time if that's not something that they're looking to get an abundance of experience with. It is certainly available in almost every clinic, but there also everything else is available as well. The VA also offers experience in a number of different types of programming. Each of the VA's mental health teams involves an interdisciplinary team, so it's really a great opportunity for folks to get experience working with other disciplines. And the VA tends to be kind of one-stop shopping for many of our patients. So VAs have programs in folk rehab. If people are having issues with homelessness, financial issues, there are resources that are available within VA to address all those different areas. So it's really a nice opportunity to address any kinds of psychosocial issues as well as mental health issues that someone may be experiencing. VA training programs, this was a new one that was posed, I think, maybe last year during one of our exit interviews, that one of our trainees was thinking that the VA training programs really prefer PhD or PsyD candidates, or feeling like the VA prefers clinical versus counseling, psychology applicants, and really there isn't a distinction that's made within VA. The biggest priority is that individuals have had clinical experience with the population that they're applying to work with. Within VA, PhD and PsyD psychologists perform the same duties. Distinctions aren't made between clinical and counseling psychology within our system. So the more active ingredient in what makes someone competitive is if they're applying for a postdoc that's in geropsychology, that they have some experience in geropsychology. The particular degree or designation within their doctoral program really is not a factor or something that's a major consideration. And those were the biggest myths that we wanted to make sure to address. And now we can take any questions that people have.
What questions do folks have for the panel?
While people are typing, I'm going to jump in and say one of the things that I'd like to encourage all graduate directors of clinical training to do is reach out to your VA training programs in your area, because I think you'll find that there are a lot of psychologists who are willing to collaborate with you, maybe talk with your students, partner with you to facilitate any kinds of collaborations that are mutually beneficial. I think what I've found in our community is that when we are all working together, we're all benefiting, and so don't hesitate to try to reach out and make those connections. I think you'll find most programs are quite receptive.
Any of the panelists have any final thoughts too as folks are thinking of questions? Thank you, Kristin. That was very helpful.
This is Jeff. I'll just say, if you have not had students rotate in practical placements, don't be surprised if your students, once they go into these practical placements, absolutely love it. And if it's an inroad for them to consider not only a VA internship, but VA employment after that, it really does provide a wide range of being a practicing psychologist across the competency areas. So.
There's a question from Aaron about whether a permanent resident would be disqualified for stipend positions.
If they're not a citizen, and again, some of these, some of the specific situations you may need to follow up with a specific training director about, but if they do not have citizen status, they would not qualify for a paid position.
All right, Jeff, I'm going to keep you going. When does the DCT need to fill out the TQCVL? And is it sent to us by the training director of the site?
So the answer to the second question is yes, it will be coordinated through the specific, I'm assuming this is a question about an intern that was matched, but Laura, if that's not right, please correct me on in the box. So good, it's an intern. So the director of training for the site should be reaching out to you to get that TQCVL completed prior to the onboarding. The time frames can vary, but if you assume a July 1st start date, you'd want to get these done probably at least a month in advance. And so one of the things that you could do, Laura, is reach out to the DCT and ask as a part of this presentation, is this something that will be forthcoming? But that's who you should get it from.
This is Kristin again. I'm going to chime in and reiterate that if you've seen one VA, you've seen one VA point. The training director at the VA is always an appropriate point of contact for those kinds of questions. I know I am very fortunate at our site to have someone in our education office that I collaborate with, and between the two of us, we make sure all of that documentation and hoop jumping to get people onboarded gets completed. So don't be surprised, depending on the site that you're at, if that email or outreach request comes from someone different than the training director, but we're always available and should be directly involved in that process one way or another.
There was a question about immunization. I just lost it. About where to keep. Hang on. Any thoughts on how? I don't
know, and I mean, I think I saw it in terms of keeping the immunization records. I don't know that there is a requirement to maintain these records, but certainly having a process where the student has provided those to you and you've been able to, to look at them to verify, and that you have a process of going through and doing primary source verification. You can look at the guide, which was developed with our HR folks as well, but I don't recall there being any requirement to maintain part of a health record in their training file. It's just making sure that you've looked through the records and that you've gotten that primary source verification from the.
Tiffany, there's a question about the slides. Oh, there you go.
What I can do also is email the slides out to everybody who registered for the webinar today. So in case people do have trouble downloading the slides.
If a student matches at a consortium that includes a VA, do they need to meet the citizenship and selective service requirements?
Great question, and I'm going to, it depends on how the pay is done at that consortium. And so whoever asked that question, I would encourage you to reach out to the DCT of that consortium. You can also reach out to me directly, or both of us at the same time. The DCT would be the most appropriate person to start with. If there's questions, I can also get those answered through our office. My email is just my first name, jeffrey.bates@va.gov. That's really likely going to come down to payment. Most consortium sites have, the VA is at least paying for part of the stipend, and I believe that means that the same requirements would be present. If the university or the other partner in the consortium is fully paying for that site, there may be some caveats to that. So I think the safest answer is to encourage you to talk to the DCT and then circle back to me if your questions aren't answered.
I see Kristin had said that you have been advised to keep the documentation. I can understand that if you're filling out a form saying that you've reviewed it, that you might want to keep it. I know that we have a separate file that we keep for more sensitive information, so I'm not sure if that's helpful. But I know as a training director, I have a different file that has their health information that I've had to review.
Kristin, if you'll forward that to me, and again, the email is jeffrey.bates@va.gov. I'd like to get our onboarding specialist to weigh in on that just to make sure that you're getting the most current and accurate information.
Any other questions? All right, why don't we take this time to wrap up. Thank you, everyone, and thank you, Tiffany, for hosting us again. And those of you that were able to join us for the lunch hour, we really appreciate it. And welcome any feedback for things we could do in the future that would be helpful for coordinating efforts and training with the training directors. So please reach out to any of us. We'd be interested in any needs that you have as training directors, and I'll put my email on there as well. Thank you so much.
Thank you also to our presenters today from VA Psychology Training Council. This is a big help, very informative. And in a farewell from me, Tiffany, and just a reminder, I'll email the slides to all of you who registered for the webinar, along with the recording, the link to today's recording, so that way you can view it for future reference or share with your colleagues. And it will eventually be posted on our Division 18 VA section website for future viewing, but it may take another 3 to 5 business days to be posted. So thank you all for being here again. Bye.
Bye.